for our seminar this morning on men's health. I really look at it as we're just going to have an opportunity to have a conversation. I think when we talk about men's health, everyone knows that when we think about men's health, we know that there are indeed some disparities that we know about. And so just for a few facts this morning, we know that approximately 230,000 men died last year were diagnosed with prostate cancer. When we look at that population over 18, 13% have poor health. 51% don't meet the physical health criteria for 150 minutes of exercise per week. 14.1%, and these are all statistics for men, smoke. 40.5% are obese, and 51.9% have hypertension. So our discussion today is really focused on how we become healthier. And although the focus is on men, I think any of these really facts and tips that you'll hear today will be really important for anyone. So thank you very much for joining. My name is Yvonne Collins. I am the Delta Research and Educational Foundation Citywide Coordinator for Chicago. And again, I welcome you. The NIH funded several organizations, the Delta Research and Educational Foundation being one of them. And this is our list of executives. And really the goal is that we educate the African American community on the importance of clinical trials, research, and wellness. The NIH chose these 12 cities, Chicago being one of them. And this is where all of the education takes place every month, in addition to a lot of our HBCUs. You'll see we have Wisconsin and Atlanta, Shreveport, New York, New Orleans, Miami, Houston, just to name a few. The Delta Research and Educational Foundation was established in 1967. It's a major nonprofit with the goal of supporting African American women and their families. This particular campaign is to create awareness around health and wellness, and our focus is the African American community. For those who were funded, it was the African American community, it was the Latinx community, it was the Asian community, seniors, and LGBTQIA. Let's watch this video on what's been happening.
In 1967, Delta Sigma Theta Sorority Incorporated established the Delta Research and Educational Foundation as a public charity supporting scholastic achievement, public service programs, and research initiatives focused upon African American women and their families. Today, DREF remains strong, vibrant, and poised to meet 21st century challenges with the same unwavering spirit and dedication the sorority originally envisioned. The charge to realize social and economic equality for future generations of African American women continues as the guiding principle. Since 2017, DREF has received funding from the National Institutes of Health to continue its role as a national community engagement partner to promote the All of Us research program through a community awareness campaign that informs African Americans and minorities about the importance of understanding and participating in biomedical research. The National Health Initiative, conducted by the Delta Research and Educational Foundation in collaboration with Delta Sigma Theta Sorority Incorporated and the National Council of Negro Women, is entitled Research Matters: Creating Possibilities to Achieve Health and Wellness for All of Us. The objectives are to engage, educate, and ultimately enroll African Americans in the National Institutes of Health All of Us 1 in a Million campaign, a national database primarily comprised of diverse and traditionally underrepresented populations. The mission of the All of Us research program is simple. It is to speed up health research and medical breakthroughs by asking 1 million people to lead the way to provide the types of information that can help create individualized prevention, treatment, and care for all of us. The All of Us research program is a part of the Precision Medicine Initiative created during President Obama's administration. Precision medicine is healthcare that is based on you as an individual. It takes into account factors like where you live, what you do, and your family health history. Precision medicine's goal is to be able to tell people the best ways to stay healthy. If someone does get sick, precision medicine may help healthcare teams find the treatment that will work best. This will help give healthcare providers the information they need to make tailored recommendations relevant to people of different backgrounds, ages, or geographic regions. African Americans continue to have some of the highest incidence, prevalence, and mortality rates from chronic diseases such as cardiovascular disease, diabetes, obesity, hypertension, mental health, and HIV/AIDS. Yet we comprise only 5% of clinical trials participants in America. Our focus and objective is to create awareness about how research matters in closing the health disparities gap. DREF seeks the assistance of national organizations, local chapters, sections, community leaders, and organizations to make the All of Us research program a successful endeavor. The influence, leadership, and participation of the aforementioned groups are needed to assist in promoting this groundbreaking opportunity. Individuals, groups, and organizations are welcome to assist with conducting and/or identifying outreach activities. Training, materials, and monetary resources may be available to support groups and organizations with approved collaborations. Please send an email of interest to researchmatters@deltafoundation.net outlining upcoming activities and events in which the All of Us research program can be included. For more information, please visit www.joinallofus.org/DREF.
So as part of the citywide coordinator engagement objectives, we have 2 webinars per month, really focusing on educational topics such as we will do today. Given the pandemic, the vast majority of our webinars have been virtual, but we are moving out into the open public space. So if you have events or activities that you would like us to participate in, please reach out. We'd be more than happy to participate. You may ask, what is the NIH All of Us research program? Well, it's a longitudinal study that will be historic. The goal being to accrue 1 million diverse participants that don't normally participate in medical research to help accelerate medical advances. Let's watch this video.
So tonight I'm launching a new precision medicine initiative to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to the personalized information we need to keep ourselves and our families healthier.
My name is Janelle Johnson. I'm a biologist in the Laboratory of Neurogenetics for the National Institute on Aging within the National Institutes of Health.
Dr. Janelle Johnson has long had an interest in neuroscience, especially in neurodegenerative diseases.
My focus is on the genetics of neuromuscular diseases, in particular ALS, but I also study neurodegenerative diseases such as Alzheimer's and Parkinson's disease.
Developing treatments for these diseases, treatments that are geared to the individual person, is also one of Dr. Johnson's goals.
Research has advanced to the point where personalized medicine has become a reality. And when I say personalized medicine, I mean that specific traits that you might have are more easily targeted by particular drugs. As researchers, we can target those drugs and find the best possible solutions for your diseases.
To find these solutions, scientists need to conduct clinical trials, research studies with volunteers, to see which treatments are safe and effective, and for whom.
If African Americans participate in research studies, they have the opportunity to treat or ultimately cure diseases. If not, we won't be sure if the current studies will apply to them.
Dr. Johnson says that more African Americans are needed for these studies, but there is sometimes reluctance to participate in clinical trials.
African Americans are often fearful of participating in clinical trials, and I think this largely has to do with the Tuskegee syphilis study, which lasted for about 40 years, so a lot of people were impacted by that.
However, today protections are in place that make participating in a study a very safe experience.
I think that African Americans can take time to educate themselves and others about the clinical trials that exist and the informed consent process.
And so you may ask, what is precision medicine? Well, precision medicine takes into account what makes you the individual. So your family history, your lifestyle, your environment, your biology, your socioeconomics, and also your genetic makeup. There's a really big oncology conference this weekend here in Chicago. And the session that I went to last night really highlighted for endometrial cancer, which kills thousands of African-American women each and every year, some new genetic abnormalities that have been identified. And now very precise medications to target those genetic abnormalities, where before women would die at, say, the 6-month mark. And now with these new drugs, we're seeing women live longer and longer, to where at 3 years, there's no evidence of disease. So there's a really important precision medicine is really important in many avenues. Oncology just happens to be one. And this study, I think, will push that forward. The All of Us campaign also is part of our community partners. We have healthcare partners. And in Illinois, those are listed here: Northwestern, Rush, University of Chicago, North Shore, and the University of Illinois. And I put those up because hopefully some of you will consider joining the research project. And these are any of the institutions, if you're local, that you can go to. If you aren't local, you can always go to www.joinallofus. But just a little bit of what happens when you go on site. You can enroll and consent prior to arriving. You can answer an array of surveys about your personal health habits, your eating habits, your exercise habits. While on site, they take a series of physical measurements. That is your blood pressure, your height, your weight, hip and waist circumference, and they collect samples, blood and urine primarily. And if you wear any digital device like a Fitbit or an Apple Watch, you can also connect that to the system. And why is that all of that is important? This is probably the first year where we now have scientists actually using the data. And so say, for instance, I'm studying hypertension, and that's one of the classes where we know the medications on the market, some don't work as well in the African-American population. So as a scientist, I may say, I want to focus just on the African-American population to see if some of my studies that I've done in other majority populations, do I get the same results? So this research project will give scientists the opportunity to do just that. So again, if you're at all interested, and we hope you are, you can go to joinallofus.org/Illinois or joinallofus.org/DREF. These are all of our social media handles. Please feel free to join us there. You can actually see videos from some previous events and learn more about the research campaign. Again, any questions, concerns, feel free to reach out to me. I can be reached at rmchicagocc@gmail.com. I'm really excited today. I think we have a fantastic panel. But before we start, I'd like to read you this disclaimer. The views and opinions expressed by the guest panelists and/or presenters do not reflect the views or opinions of the Delta Research and Educational Foundation, that's DREF. DREF Research Matters for All of Us, the NIH All of Us Research Program, or any of its affiliates. Thank you again for joining us. This is our all-star lineup for today. I will introduce each of our speakers prior to them speaking, but I think you're in for a treat today. We'll do questions at the end. If you have questions, feel free to place them in the chat and I will gather them from the chat, but I'll open the floor after everyone is done speaking. We will start first with Mr. Anthony Young. Anthony Young is a professional nurse with over 20 years of experience in various nursing roles. He received his Bachelor of Science in Nursing from the University of Maryland, his Master's of Science in Nursing with a concentration in public health from Emory, and now currently works at the New York University School of Nursing with a specialization in palliative care. He's passionate about making a positive difference in the environments that he serves. Healthcare planning is what he'll talk about, which is very important because we don't want you to have to make decisions at the end. We want you to be fully aware and cognizant to make those decisions. So Mr. Young, I'll turn it over to you. And if you can just say next, I'll advance your slides.
Thank you so much. Thank you so much, Dr. Collins. Can everyone hear me?
Yes.
Okay, perfect. Thank you, Dr. Collins, for allowing me to take this opportunity to share with everyone in regards to advanced care planning. So the impetus for me talking about this topic is I work with patients who are at the end of life, and it's very important to be able to plan. So we have insurance policies, we have car insurance. So that's our safety net or advanced planning in regards to our car, in regards to life insurance. But we also need to have an advanced plan in regards to our health and also to our finances. So why advanced care planning? Advanced care planning is because you want to be able to know what your values are and what your wishes are if you're in a position where you're not able to make decisions. And you want to make sure that you clarify those with those loved ones, family members, and friends that need to know if by chance they're going to make decisions for you at that point when you're not able to make those decisions. So we'll briefly go over that today and give you just some thoughts and some resources to be able to establish or refine your advanced care planning documents. Next slide, please. So when you're talking about advanced care planning, just some highlights that you want to keep in mind. You want to definitely have the discussion early. Having it early is that you're not waiting to the last minute and everyone is emotional and they really can't think clearly. So making those decisions early is very important. Creating those documents, living will, a durable power of attorney, that will then outline clearly what you want to do, what you want done, what your wishes are, what do I want done, what do I not want done. Making sure you have copies of those documents and you distribute those appropriately for those who need to know. And then making sure that you have the original documentation in a safe place so anyone can access it. And then reviewing those documents regularly. Things will change. People who are on that document may change. Your values may change. Your wishes may change. So you want to make sure that you're reviewing that document at least every 5 to 10 years or as needed if any changes do come up. Because just think about it. If you are in a situation where you can't make those decisions for yourself, critically ill, and think about individuals who've gone through COVID and family members having to make those challenging decisions at the last minute. If there's no documents in place, that is compounded on top of the situation that the individual is going through in regards to dealing with the end of life and those challenges. So having those things documented very clearly and providing clarity it makes the situation better at the end of life. So definitely making sure those things are done early is very, very important. Next slide, please. So it is a very daunting task just to think about, well, what do I want done when that time comes where I'm not able to make decisions? How do I go about it? So I'm the type of person where I want to make sure things are broken down in workable or achievable chunks, so it's not overwhelming. And as I mentioned, this topic can be very overwhelming for everyone. So this is a framework that can help you through that process, just to do it bit by bit, breaking the steps down. So first, thinking about it, you as an individual, and you can help family members and friends go through that process themselves. What are your values? What are your wishes? What do you want done when that time comes? Having those, talking about it. So number 2 is talking about it. Having those conversations with family members and friends that need to be aware of what your values are and what your wishes may be. In addition, having those conversations with those individuals that you identify as your healthcare agent, that individual who's going to make decisions for you, or a durable power of attorney, and making sure that 1, they're aware that they're in that role, and then 2, that they understand and they know what your values and your wishes are. Number 3, record. Again, you want to document what those wishes are. Living will, durable power of attorney, so that we will know, or your family members and friends will know, what it is you are expecting at that time. Discussion. We talked about it, but then you want to have that discussion with your healthcare team, your physician, nurse practitioner, any of those individuals who are involved in your care. You want to make sure that they are aware of it, 1, and then that you also provide them with the documentation so that they will have it on file within your medical record. And then the last piece is share. You want to share with anyone else that you didn't capture when you talked about it and when you discussed it, to make sure that everyone that may be involved in that process or in that time is aware of what their role will be at that time. Next slide, please. So this just gives you a breakdown of things I have referred to not too long ago. So what do I need to put into place? You want to put in place a living will. So again, you want to be able to outline, what do I want done? What are things I do not want done? Do I want to have a tube placed down my throat to help me to breathe on a machine, a breathing machine, a respirator, a ventilator? many terms that you may have heard on the news as we've gone through the pandemic, the COVID pandemic. Do I want a feeding tube? What things do I want done to help me during that time? And then the next piece from an advanced directive perspective is the durable power of attorney. Again, who's going to make those decisions for you? Who is that individual that's going to make the decisions for you in regards to healthcare, in regards to finances? You want to make sure you have those individuals in place, individuals that you trust, and those individuals that then know what your wishes are. And then many of us may have property, we may have money in different places that we have for resources and support. We want to make sure that we have wills and trust in place to make sure that we have, again, documented what's going to happen with that property, what's going to happen with that money that we have in place. Always keep in mind, we all live in different states. States have different laws, so we want to make sure that we are aware of what those laws are, rules and regulations within those respective states. If you're not aware, you can always reach out to your local bar association, or if you have any contacts that can give you insight onto what those state regulations are, that can be of support to you during that process. So to make sure that you're in line with what needs to be done. The most important piece that I want to take home today, if you get nothing else out of what I've said today, is starting a conversation, having that time to think about it and reflect yourself, and then having that conversation with family members, friends, and also your healthcare team. Next slide, please. So this is a template, 5 wishes. It's a template that you can use to help you to structure your thoughts of what you want done. There are a few elements that it breaks down into to help you to outline what your wishes are. Who is the person that I want to make decisions for me? The kind of medical treatment that I want, or the kind of medical treatment that I do not want. How comfortable do I want to be in that situation? How do I want to be treated? And then what I want my loved ones to know. So again, those are the areas of the 5 wishes template. Keep in mind, as I stated earlier, states have different regulations and rules in regards to advanced care planning. And with the 5 wishes, there are 42 states, including also the District of Columbia, that will accept the 5 wishes documents as a part of your advanced directive or advanced care planning. So keep that in mind, and then again, reach out to your resources, the local bar association, individuals like that, that can then guide you on the appropriate documents. But the biggest piece is you need to start somewhere, have that conversation. What are my wishes? So using this template, the 5 wishes, can be a start to that process to get you thinking about what you want done, things that you do not want done, who do you want to act as your healthcare agent. So definitely this is a resource that you can use, 5 wishes. Next slide, please. And then these are additional resources that you can access. Many of this information I went through in constructing the slides for today. One thing that I want to highlight is the first link, or the first resource, which is the conversationproject.org. If you go to this site, it gives you a lot of resources and guides that you can use to take you from point A to point Z in regards to advanced care planning. So I definitely encourage you all to access that resource, share it with your friends, family members, etc., to give them the resources and the knowledge that they need to be able to start that process in advanced care planning. One thing that is another resource that the American Hospital Association has available is an advanced directive wallet card that you can use to document that I have an advanced care advanced directive in place. So that's very important too, because you want individuals to know, say, for example, God forbid, you're in the mall and you have a heart attack. You want to be able to have that resources available so that people will know what you have in place, and then they can access those resources. So again, I want to thank you, Dr. Collins, for this opportunity. And I want to emphasize, again, the conversationproject.org to help you through that process of advanced care planning. Thank you so much.
Thank you very much, Mr. Young. I do again encourage everyone to make the decision. As an oncologist, I've seen family members torn between what the patient potentially wants and what they want. And it doesn't always go in your favor when you're not making the decision. So make those decisions known beforehand. I tell my family all the time, I'm not keeping anybody on a ventilator. So if you want to stay on a ventilator, I need to know that. Otherwise, the tube will be pulled. So it's really important to make those decisions beforehand. Mr. Young, I'll ask if you could put those resources in the chat. That would be great. Next up, we have Dr. Ruffin, who's a fellow of the American Academy of Nursing and chair of the Stockholm University Postmaster Certificate Program. Additionally, he's the CEO of Ruffin Associates Healthy House Calls and is a certified tobacco therapist. He received his bachelor's from Rutgers, his master's from Rutgers also, his tobacco treatment specialization also from Rutgers, and his doctor of nurse practitioner from Wilmington University. He chairs the National Black Nurses Association Substance Use Disorder Committee and developed a national tobacco policy agenda for 95 MBNA chapters in 35 states. Dr. Ruffin, so happy to have you. You are up, you can come off a video and just let me know when you want the next slide.
Good afternoon, everyone. Thank you so much, Dr. Collins, for this wonderful introduction. I'm grateful for the opportunity to present this afternoon with some great colleagues. My mentor, Dr. Ursen, and very good friend, Dr. Willis, and of course, the other panelists, Mr. Young and Mr. Lewis. Thanks to Mrs. Azela Collins for recommending me to be part of this great discussion this afternoon. And thank you for bringing all of us together for this conversation. You know, whenever I have the opportunity to talk to a group of men, I think that men really care not only about themselves, but also for their families and loved ones. And when men are informed and have a clear understanding of their health needs, health promotion and services, they are more likely to make the right choice and to make the right decision. Every premature death represents a personal and a family tragedy with long-lasting impact. And the good news is that there are a lot of these, really those premature deaths, they are preventable. So if there is anything that we can do to minimize those impacts, and to really make a good change, to improve health outcomes, it all starts in the primary care setting. And I'm really grateful to be having that little conversation. Next slide, please. Next slide, please.
Yep, there's a slight delay. It should be coming up.
Thank you so much.
No problem.
All right. So we're speaking about the primary care provider. So why men need a primary care provider? The primary care provider typically referred to the PCP, and of course the PCP can be a primary care physician, and it can be a nurse practitioner, it can be a physician assistant. And when we say primary care provider, we have a all-inclusive. And basically, this is the person who work with you to help you to help understand you, who you are, what your goals are, so that that person can help you achieve your healthcare goals. And as a primary care provider myself, I see myself as a care coordinator. While I always say the patient is the driver of the care, I like to put the patient on the driver's seat, but really working together to help you to get to where you need to go. So that's why it's really important that men take care of themselves by making sure you follow up with your primary care provider to have those health and wellness visits when they are appropriate, so that you can remain healthy. So it's appropriate that men visit their healthcare providers regularly. And one thing we see is that a lot of times we think if it doesn't hurt, I mean, there is no problem, or if it's not broken, don't fix it. So the reality, so the goal of preventive medicine is to prevent anything from broken. So we don't want to wait until it's broken to fix it. So the goal is to make sure that we take care of it. If you have a car, you want to make sure you service the car regularly so that it doesn't break down. Because when it breaks down, then you have to spend a lot of money to fix it. You know, that's why you maintain your car. So it's the same principle for our health. And so it's appropriate for us to see our healthcare providers. And when you have your visits with the healthcare providers, some of the things, of course, they see that many of you know, they screen for medical issues, they assess your risk for future medical problems, encourage you to have a better lifestyle, and also update your vaccination records, and to really to help you to get to know your providers really well. And if you have a healthcare provider where you feel that, okay, you cannot have a conversation with that healthcare provider, it may be time for you to find another one, because the healthcare provider as your care coordinator, if you have to see a specialist, and depending on your age or depending on your health problems or what's going on, so that person needs to be the one who make those recommendations and to really guide you. But if you cannot have a conversation with that person, it's time for you to find somebody else. Next slide, please. So some of this health screening we will touch on very quickly, because we won't have time to talk about everything we would like to talk about. Once you, from the age of 18, it's appropriate for you to see your healthcare provider regularly. We talk about the annual physical, right? It's important that you do that, and so that if there is any problem, the problem can be identified early. For example, high blood pressure or hypertension. This is very prevalent in the African American population, and that's a high blood pressure is also called the silent killer, because your blood pressure might be so high and you have no symptoms. Although, I've had many patients who tell me, oh, I know when my blood pressure is high because I have a headache. Typically you don't have any symptoms when your blood pressure is high. So if you have a headache, that means maybe it's really, 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 really high. It's probably enough to send you to the hospital or possibly having a stroke. But you don't want to get to the point of having those symptoms for hypertension. So basically for people ages 18 to 34, it's appropriate for that to be checked at least once every 2 years. And your cholesterol causes heart attack and of course stroke. So this beginning at the age 35, that needs to be checked every year, except if you are at high risk for coronary artery disease, or have a family history of early heart attack, or you have other health conditions such as diabetes or other problem, then beginning at the age 20, so it's recommended that this be checked. And also with diabetes, checking for diabetes is really appropriate. That can be done with a finger stick or even through your regular blood work. And you can be identified as whether you are pre-diabetic or whether you have diabetes. And so again, if you have any risk factors, any family history, and you have a hypertension, or if your body mass index is more than 25, which is about 95% plus of the population is in that range. So so you need to get that checked. And of course, the eye exams, it's you need your eyes to see, to be able to do all the things you love to do. Without your eyes, you cannot function basically. Although you can, but you would have some severe limitation. Therefore, it's appropriate to make sure you get that checked every 2 years. And of course, seeing the dentist every year. Next slide, please. While seeing the dentist every year, and also with immunization, getting your vaccines done. So it's the same for men who are 40 plus. The blood pressure needs to be checked at least once every 2 years. Now, I know, if you are diagnosed with blood pressure, that's something different. But if your blood pressure is normal, and typically, of course, every time you see your doctor, if you see them every year, which I highly recommend, they would check the blood pressure as well. But at least make sure it's done every 2 years. And the cholesterol is the same, as I already said, the same thing for the eye, the same thing for seeing the dentist, but also getting a colonoscopy done. Colon cancer is very prevalent in the African American population and very prevalent in men. So beginning at the age of 45, that's regular for African American. But beginning at the age of 40, if you have a family history of a colon cancer or any type of cancer, or if you have people from your family who are diagnosed with colon cancer, so typically about 10 years. Okay, so we're talking about close family members, like brother, sister, or parents, about 10 years younger than the age when they were diagnosed. It's appropriate to get checked. And checking for osteoporosis is also really, really important screening tool, because we have a generation where we are spending a lot of time indoor. As a result, the level of exercise that we need, we are not getting them. And this is linked to osteoporosis. And beginning at the age of 50, it's appropriate for both men and women to have a DEXA scan or a bone density test done. When it comes to prostate screening, that typically starts at the age of 55. But again, this is a test that's pretty, is very important, and it can be very controversial as well, because it's a very subjective test, especially when you do the digital rectal exam test. Because if you think about myself doing your test with my big fingers versus someone with very small hands, our description of our findings will be totally different. So that's why this is not a test that's routinely done. But if you have any risk factors, it's appropriate for you to ask for that test. And of course, with immunization, such as your COVID vaccine, your flu vaccines, and your tetanus shot, and these things are really, really important for you to have. Next slide, please. All right, so basically these were the things I had for you. Actually, there are some good references throughout the presentation. And if you go to cdc.gov, you will find those information I just shared with you. And thank you so much for having me.
Thank you so much, Dr. Ruffin. Next, and again, put your questions in the chat sheet. You have questions. I did have a few come over to me directly. Next, we have Dr. Urson, who is a native of New Orleans, Louisiana. He's the current CEO and CNO of USMD Hospital in Arlington, Texas. He's certified as a nurse executive and a fellow of the American College of Healthcare Executives. He entered the nursing profession after serving as a high school mathematics teacher. He holds an associate's degree in nursing from Los Angeles Trade Technical College, a Bachelor of Science in Public Health from Dillard University, a Bachelor of Science in Nursing, and a Master's of Science in Health Services Leadership and Management from the University of Maryland, and a Master's of Business Administration from Hood College. Lastly, but definitely not least, a Doctor of Nursing Practice from Case Western University. He is a board member of the National Black Nurses Association, editor-in-chief of MBNA News, a board member of the National Coalition of Ethnic Minority Nurse Associations, and treasurer for the Association of Black Nursing Faculty. Dr. Urson, thank you very much for joining us, and I'll turn it over to you.
Thank you, Dr. Collins. Are you able to hear me clearly?
I can hear you clearly.
Thank you. Good afternoon to my brothers on the panel, those who I haven't seen in a long time. Thanks to the Delta Research and Educational Foundation for hosting this event today, and certainly appreciate the Collins family, including Dr. Yvonne Collins, for inviting me to participate in this event on today. You can move on to the next slide. Today, I'm going to present some information. My primary focus, because my love in nursing has been cardiovascular care. So today, I'm going to primarily focus on hypertension. Now, I can see many of the participants today are health professionals. You most likely will know a lot of this information, but it's truly designed to reach those beyond this webinar or this virtual call, so they can understand the impact that hypertension has on them as individuals and also on the Black community. So my topic is basically brother to brother. The message is take the pressure off, and that's what we're going to focus on over the next 10 or so minutes. Next slide. Basically, what is hypertension? We all know that. Next slide, please. Hypertension is that force of pressure within the vessel when blood is flowing. As simple as that. There are some things that force actually impacts. Dr. Collins, you can move to the next slide. A major issue with the elevation and the pressure is weakening of your vessels and the damage to major organs as your heart, such as your heart and your brain. And we'll talk more about this later on in the presentation. Next slide, please. The information on this chart right here has changed over time. I remember a time when the recommendation was to keep your blood pressure about 120/80. As you can see from this chart, the recommendation today is to keep it less than 120/80. Research shows having a pressure over 120 places you at risk for hypertension. Today's information on this chart gives you this 5-level notification system. It's like a traffic light system with more than 3 lights to respond to. Green basically says, go. You can continue doing what you're doing things right, have a good life and enjoy it. Yellow, which used to mean that you're okay, now means you can go, but just proceed with caution. Orange basically states it's time to get a plan together to turn your car around because I'm going to get into the hot zone. Needless to say, you can see from this table, red is stop. Whatever you are doing, stop right now and get some help. Next slide. Some basic symptoms we need to know regarding high blood pressure or hypertension is that you may have a headache, you can have a nosebleed, you can have vision problems such as blurred vision or dizziness, you can have difficulty breathing, all because of what's happening within the pressure that's building up in your vessels. Now, one thing we do know is a fact: nearly 20% of the people who have blood pressure don't know it. This is why, as Dr. Ruffin stated, we call it the silent killer. Next slide. I want to talk a little bit about risk factors. You can click it again. There are some things about hypertension that we can do anything about, such as age, race, gender, and family history. Blood pressure tends to rise with age, and you're going to see that later in some charts that I want to show you. About 65% of Americans age 60 and older have high blood pressure. We cannot do anything about race. Despite the fact that hypertension affects everyone, it is more common in the Black American population. We, as African Americans, tend to have high blood pressure early in life. For example, and I'm gonna use some personal examples as we go through this presentation. I was the age of 17, 11th grader in high school when I was first diagnosed with high blood pressure. We also often have more severe high blood pressure. At the time when I was diagnosed, my pressure was exactly 140/90, multiple times over several visits. Well, actually, we are more likely to be aware that we have high blood pressure and get treatment than other groups. I was not aware that I had high blood pressure, but the headache that I was experiencing over time, and those symptoms that Dr. Ruffin talked about, that triggered me to actually seek help. We are also less likely than our counterparts to achieve target control levels with high blood pressure treatment. It was difficult for me for a period of time to get my pressure down, but I eventually did just that. We also have higher rates of early death from high blood pressure related problems such as heart disease, stroke, and kidney failure. Now, men and women are equally likely to develop high blood pressure in their lifetimes. However, before the age of 45, based on the evidence, men are more likely to have high blood pressure than women. But as we age, and you'll see this in another table that I want to share with you, as we age over the age of 65, women are more likely than men to be affected more by high blood pressure. Next slide. There are some things that we can actually control when we're managing blood pressure. I'm not going to talk a lot about this right now, but everything is related to lifestyle. What I'm going to do is share some information with you at the end of this presentation, because this is what I really want you to lead a presentation with knowing today. So we can go to the next slide. In addition, there are some psychosocial factors influencing hypertension: relationships, emotional state, people in your life. You know, my family will tell you, I don't do the drama. All the, arguments and fussing and going back and forth with people, I don't do that, because those type of things actually impact your level of stress and blood pressure. There's evidence 5 to 10 years ago, about 25% of Black men were actually uninsured. And we know that we already have an issue with getting access to care. And when you're uninsured, in addition to the lack of access to care, it makes things worse. So you're not able to get the resources or the education that you need in order to manage your blood pressure. I believe that we have better systems in place today regarding access, better than what we had 15 to 20 years ago, but there is still a problem. In many cases, we don't seek out that preventive care. Again, we just had a discussion regarding primary care. Those services are available. There are clinics in our communities, but our people are not necessarily going to get that preventive care that they need. And I experience it all the time. Not going to specify, but even one of my family members, it's, I'm feeling bad, and it's blown off as, oh, it's just a headache, or I'll get over it in a couple of days. But you really never know what's going on with your body. And many times you have to go seek out that care, but we tend to kind of put it on the back burner, if you will. Next slide. We're going to go through, next slide again. We're going to go through some hypertension stats, and I'm going to put a different twist on this. We'll wait for the slide to come up because I need you to see it.
It's working through, it's coming.
Got it. Thank you, ma'am. Appreciate that. If you had a family reunion and 200 of your cousins showed up, about 66 of them have hypertension. Less than 33 of them are under control. 40 of them don't even know they have it. 60 of them are actually pre-hypertensive. That's the yellow zone that I mentioned earlier on the recommendations from the American Heart Association. And 50 of 66 of them are actually using their medication. Just kind of a perspective, a fan of perspective based on the statistics that are presented before you. Next slide. About 69% of the people who have their first heart attack, 77% who have their first stroke, and 74% who have congestive heart failure. They all have one thing in common. They all have high blood pressure. Next slide. Just a little bit from the racial disparities, and you can see this in any evidence online in the books. Historically and consistently, African Americans tend to have higher impact, negatively impacted from high blood pressure. And you can see that. You're going to see this in other information I'm getting ready to share as well. Next slide. Now, for those of you who follow the research, you may have seen this particular map before, because about every 3 to 5 years, it's updated. I remember doing a presentation in the past on hypertension in Black males. I used a slide from 2011. I did find one online from 2015, and this one is reflecting 2017. The point of this is it hasn't changed over time. What you find is that the darker colors are predominantly in the southern and southeastern states. This tends to be states where people of color are more populated. So you would expect the prevalence of hypertension to be a little bit more elevated. Next slide. Hypertension was actually projected to increase about 8% between 2013 and 2030. This information basically shows the same perspective shared previously. Basically, rates among the Black community tend to be the highest. Next slide. This information basically shows the exact same thing, whereby we have higher rates of hypertension and Black African Americans among our counterparts. Next slide. This particular slide actually shows what I mentioned earlier regarding the age disparity between Black men and Black women. As we get older, you'll see where Black women, the incidence of hypertension in Black females tend to outpace that of the Black male. And I know we're focusing on the male today, but in the process of doing this, I can't ignore the fact that hypertension also impacts our queens. So it's important that this message not only go to the Black male, but also to the Black female. Next slide. There is a significant amount of money contributed to hypertension on an annual basis, and just want to briefly show you the numbers around this. The cost to the nation to treat hypertension, the healthcare services, the medication that are provided, and the days that people miss from work, it amounts to about $131 billion annually. That's simply what I want to show there. There are some implications for high blood pressure. And I know one on this, if you go to the next 2 slides over, one significantly impacts the male among all of them was more personable, and that's the sexual dysfunction. Because our males need to know when your blood flow is not flowing adequately, it does impact your ability to function sexually. But other major areas, it does impact blood flow in the brain. We talked about the vision issues earlier that potentially happens due to hypertension. You also have heart failure. We also talked about heart attack, and kidney disease is also impacted by that. Just in essence, as an example, over time, the uncontrolled high blood pressure can cause arteries around the kidneys to narrow and weaken or harden. This prevents, this particular action damages the arteries and is not able to deliver enough blood to the kidneys to actually oxygenate the tissues for the kidneys to actually function, causing kidney disease and or failure. Now, the next couple of slides is the point that I want to share with our community today and how we take the pressure off. There's something that we call, many of you all know about, is the DASH diet. The DASH diet, dietary approaches to stop hypertension, essentially helps to reduce salt, prevents volume overload, and it can help actually reduce your blood pressure by a few points in 2 weeks. There is evidence to show that over time, your systolic blood pressure could drop between 7 and 12 points. And those, our medical professionals know that I'm talking about millimeters of mercury. But for the community, I'll just say points. So the DASH diet has been known to make a significant impact in reducing health risk. The next slide, well, that slide goes into fruits, dietary. The next slide goes into recommendations on grains and cereals that you should eat a part of the diet, including vegetables, the number of servings per day, and meats and fish, things of that nature. There was a study that was actually performed comparing the effects of consuming the DASH diet with a typical high-fat controlled diet among 459 adults with normal or elevated blood pressure. Among 133 patients with hypertension, the DASH diet actually reduced systolic pressure by 11.4 points. Among African Americans, the DASH diet was more beneficial. It reduced their systolic and diastolic pressures by 13.2 and 6.1 points. Next slide. I'm going back to one of the beginning slides when we talked about things that we have control over. Lifestyle changes. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. Losing even a small amount of weight, if you're overweight, can reduce your blood pressure. In general, if you reduce your blood pressure, you can reduce your blood pressure by 1 point if you lose 2.2 pounds. Regular exercise is important as well. There was some information that showed 150 minutes a week. I don't think we really think like that, but people know 30 minutes a day, 45 minutes a day. And a lot of individuals really push it 5 and 6 days a week. Some people even do 7 days a week. But you can start simple, do 4 days a week, 30 minutes of exercise. That can actually help lower your blood pressure by 5 to 8 points. Generally, I'm going to alcohol. Generally, the suggestion is that women should have 1 drink a day for those who actually drink and are hypertensive. Men should actually do 2. You can actually lower your potential for your high blood pressure by 4 points if you actually do that. And we all know the impacts of cigarettes on our vessels, on our lungs. If you stop smoking, naturally, that reduces your risk for heart disease significantly. So that's just a point right there. I would like to share with you, some time ago, I remember looking at a video of a physician in Houston who had heart patients who were placed on vegetarian or vegan diets, and the impact that it had on those individuals. I don't know if this is the same physician, but I do want to share with the community some information that's available that can be significantly helpful to you. I believe it's Dr. Baxter Montgomery out of Houston. He's done a lot of work around disease and diet. One example I'll share with you as I come to a close, he had a patient who had lupus, hypertensive, started off with a blood pressure of 174 over 106. The patient came to him on multiple meds, a huge regimen of medication. 4 of those meds was on board to manage her blood pressure. He placed a patient on a nutritional detox with a small change in the blood pressure medication. With a blood pressure of 174 over 106, you can't take anybody off. You can't take a person off. So he made a slight change in one of the medications. That patient, in addition with the medication change and the nutritional detox, achieved a blood pressure and maintained at 126 over 81. Significant impact with diet changes. Now, the research available shows these measures actually work. Exercise, diet, not smoking, limiting your drinks, and making sure you take your medications also, and seeing your physicians, but it actually works. So I wanted to share, as I close, a personal story with you. Remember, I was diagnosed with high blood pressure at the age of 17. 5 years ago, it'll be 5 years, July 1st, I stopped eating meat. I increased my exercise regimen. At that time, I weighed about 260 pounds. In 3 months, with a change in diet and exercising, my cholesterol went from what was normal 220 plus to about 164. I actually got down to about 240 pounds. I stayed on my diet, still haven't eaten meat in 5 years, but I gained weight. Why? Because I like carbs. And several of you all on this meeting know that I like cakes and cupcakes. I eat it all the time. So I gained weight. January 1 of this year, I weighed 265 pounds. I said enough is enough. So I started exercising more. I got on a regular exercise regimen, 4 days a week, cardio, treadmill, cycling, and weightlifting. I also reduced the carbs. I stopped eating bread, spaghetti, just a number of things. And I treated myself to a cupcake on March 1st of this year. So I went 60 days without. My staff at the hospital was stating, you need to stop. My executive assistant says, Dr. Erson, please stop what you're doing. You're losing too much weight. So she could see my clothes were I was losing weight, my clothes was looking much bigger. So I got to get a new wardrobe. But after my efforts, after 5 months, hey, you all know me, I'm 6'3". I currently weigh 230 pounds. And 6 weeks ago, I went to the physician and he looked at my record over time and he says, I don't know what you've been doing. I don't know why you're still taking blood pressure medication. So I'm down to 230. I am off of my blood pressure medications and I'm feeling very, very good. That's my presentation for you today.
Thank you so much, Dr. Erson, for the presentation and the story. I think the real life story makes definitely a big difference. And that is actually a very good segue. Sometimes we don't want to listen to our healthcare provider. So I wanted to bring a little bit of real world experience to you today also. And so Mike Lewis is going to tell his story. He began his healthy living and run journey in 2014, when he ballooned to an unhealthy 335 pounds. He lost both of his parents due to diabetes, high blood pressure, and numerous other elements, and decided that he would begin his quest for better living. In 2016, after becoming a member of the Black Men Run New York City, his love for running grew. And since 2017, Mike has run 8 marathons across the world and numerous half marathons nationally and internationally. Thank you very much, Mr. Lewis, for joining us, and I will turn it over to you.
Thank you, Dr. Collins. You can jump to the next slide right away.
Yep, there's a slight delay, just to let you know.
Okay, thank you. I appreciate everyone for being on this call this afternoon. I thank you personally. I don't know how I can follow the gentlemen who have gone before me, but I'm just here to share my story. Dr. Erson, you've done amazing, and I just wanted to share my similar story. As you heard in my bio, I decided to make a life change in 2015. And it's been difficult. Like I sit here and tell you that it is not easy. You just have to have the commitment and just do it. I see a few of my brothers on the call, so I want to thank my brothers from Alpha Phi Fraternity Incorporated for being here today. I want to thank everybody who else is on the call. I see my other brothers from Black Men Run New York City out here also on the call. So today I'm just going to tell you a little bit about my journey. Born and raised in Brooklyn, New York, and I'm a graduate of Temple University. Athletic my whole life, played sports. You think of it, I did it. It's a little different nowadays, right? Kids don't even go outside, where when we were outside playing tag, running, jumping, doing all of that. I got into organized sports early. I started playing baseball around the age of 6, and played organized sports, including football in college at Temple University for a little bit. And then I came home. And when I came home, I could tell my lifestyle was changing. Dr. Erson was talking about drinking, right? I remember early after graduation, alcohol was a constant part of my diet. And it took me to what the picture you see on the left is. That picture was taken around 2016 when I first started running with Black Men Run. Some of the things that I noticed started happening, right? We talk about having a headache. I experienced that. But the biggest thing that happened for me was after work every day, it never failed that I would go home, sit on my couch, and go to sleep. I was 25. I was tired every day. Never fails. Yeah, I got up at a normal time and started working. You can head to the next slide. I got up at a normal time and started working like everybody else, but I would come home and go to sleep for hours and then wake up, it's 9, 10 o'clock at night and it's time to go back to sleep. That was the first thing those were the days when I decided that I had to make a change, because there's no reason at 25, I'm so tired sitting on my couch. So like one of the previous presenters said, I think it was Dr. Ruffin, he mentioned like, you have to have a PCP. I first went to my doctor, all the sports and things that I did over the years, I had to go to my doctor to get my knees checked. Come to find out, in my battle of having that checked, I had high blood pressure. For me, one of the biggest things was that because I was athletic my whole life, my pulse was very low. So I had a low pulse. My pulse was 40. But my blood pressure was 125/82. And my doctor was nervous. So he did the full workup and made sure that I was healthy and good to go. After that, I made sure I had my knees checked, I had my blood pressure checked, I had my heart checked, just to ensure that I was healthy. And then I began my journey on doing what I love, right? So one of the biggest things with physical health is you have to do what you love. You have to be able to enjoy whatever the workout is that you're going to do. You have to do it to enjoy it. Kickboxing. For me, it was running, but it was running, weightlifting, and I found yoga later in life. But if you enjoy kickboxing, if you enjoy cycling, whatever it is you enjoy, that's the activity that you have to use to carry yourself on your journey. Because if you don't love it, you won't do it. If you dread being in the gym, you won't do it. Maybe your alternative is to go out to the playground and utilize the monkey bars, or there are always activities. We call it the core workout. And there are always activities, benches, and things in your local parks, in your neighborhood, that you can utilize to carry on your journey of physical health. Some of the benefits, as you see, I have listed here: physical activity, of boosting energy, and weight management. For me, it definitely lowered my blood pressure. Both of my parents had diabetes. So once I noticed that I needed to make that change based on that was what I did. Just want to make sure I don't get lost here. And overall, it increases your chance of living longer. So you can go to the next slide, but if you see the pictures, those were me not that long ago. Aside from working out and finding running, the other thing I had to do was change my diet. I don't remember who told it to me, but I will give somebody credit. They told me you can't outrun a terrible diet. So in the past, I used to eat whatever I wanted. It was crazy. Fast food all the time. I ate McDonald's 10, 12, midnight, 2 in the morning. But I was told that you can't outrun an unhealthy diet. I didn't utilize vegetables on my plate. I don't even recall liking broccoli or eating any vegetables. But now I've incorporated those into my life. Most of my plates now probably have 70% vegetables, right? You just have to do what works for you. Around food, one of the things I did want to mention is you hear about all the diets and ways that you can lose weight and do things. You have to do what works for you. I believe Dr. Urson said that he doesn't eat carbs, right? Some people can't give up carbs. He made that choice, but you have to be able to do what works for you. I'm sure everybody's been hearing about intermittent fasting. That works for some people. You have to be able to do what works for you. For me personally, I tend to float through each and all of those things. Sometimes I'll randomly pick time frame of what I'm doing. So if I'm in training mode, I may go to a liquid diet for a couple days, where I do no solid foods. I just smoothies, veggies, all my intake of food will be a liquid diet. You can go to the next slide. So the picture you saw there was one of my brothers and I who started growing our own food. So that was another thing that I kind of changed in my lifestyle. Even if you go to the store and you buy what you think are the cleanest vegetables out there, you don't know what kind of pesticides, insecticides, all kind of things are in food. So we made it a point to start growing our own food. Like I said, I live in Brooklyn. That is our community garden that we're posted up in front of, and we actually donate food because we often grow more food than we utilize. So we donate food to our community just to make sure that we are spreading the word and the love of healthy living. So as you see, I'm a part of Black Men Run, or as I said, I'm a part of Black Men Run New York City Way. And that is the run group I run with. Black Men Run is an organization that believes changing the trends of high blood pressure and diabetes in Black men. And so we've decided, and it's a conscious decision, like to embrace men's health. So that is a part of what brings me here today. So research tells us that running on a regular basis, and I think Dr. Urson said it before, like running on a regular basis, 30 minutes of exercise a day, all increase mental sharpness and help you get to where you need to be. And again, I just have to emphasize over and over and over again, you have to do what works for you. So what Black Men Run is an organization. You can actually go to the next slide. We're an organization in Brooklyn, but we are across the country. I want to say there are over 75 chapters across the country. So wherever you may be, there definitely is a chapter for you to join that just takes brotherhood and health seriously. One of the things that we always say is health is wealth. And that's the most important takeaway that I want people to remember. Health is wealth. So if you're in a hospital, you may be at a place where you're calling up Brother Young, who spoke first about writing that will out, right? Health is wealth, and you just have to take it seriously. So Black Men Run, we run out of Brooklyn, New York at Prospect Park. The times we meet are Sunday and Wednesday. Sunday, we meet at 9:30 a.m. And Wednesdays is 7:30 p.m. So we have an option for anybody. If you can't make it during the day, you can join us in the evening. But we are such the organization where you can call up any one of us. And if you need to run then, there's probably somebody who will jump in and run with you. Our motto, no man left behind. I have a running picture of myself up. The gentleman behind me is another part of Black Men Run. This is us running New York City Marathon last year in November. And there's never a time when you don't have support being a part of Black Men Run New York City. You can head to the next slide. So for me, like it was mentioned, I've run 8 marathons. Internationally, I've run 2. I ran, I'm gonna I'm gonna draw a blank. I've run internationally, I've run Berlin, and the other one's not coming to me, but it will. I've run across, I have 18 states under my belt. I've even run a half marathon in Ireland, and my goal is to complete the 6 world major marathons and 50 state half marathons. You can head to the next slide. That's a picture of me in Chicago. So people are like, well, why do you run? And the best thing I can tell you is I run because I like to travel. So in 2016, when I started my run journey, I had the privilege of going on a world tour, and I ran, I want to say 30 races in 2017. I ran 30 different races here and abroad. And that was the year I was able to meet so many people. If you look on the left, that gentleman is Juan Carlos, who stood on the podium with Jesse Owens. And on the right, Fred Hampton Jr., who I had the opportunity to meet in Chicago. So running has taken me all over the place. You never know who you'll meet. It is my outlet for travel. I've probably done more traveling runs than I have local runs, because that is what interests me. So you can head to the next slide. So this is my information, and also Black Men Run New York City Way information. If you are interested in joining us, again, we are out at 9:30 a.m. on Sunday. We meet in Brooklyn, New York at Prospect Park. And if you look up Black Men Run, if you Google it, the website will tell you based on where you are, where the local chapter in your area meets. So please feel free to join us. Again, just remember, you have to do what works for you. And health is wealth. And I just want to thank you all for being here today. And thank you all for having me to speak on this panel.
Thank you so much, Mr. Lewis, for bringing it home in terms of really focusing on what works for you. I'm going to stop sharing. We've heard about the importance of diet. We've heard about the importance of exercise, of mindsets. We've heard the importance of ensuring that we have our affairs in order. And just want to close out really with self-care. How do we do that? How do we get past negative thoughts and doubt and really building yourself up? So I want to bring on Dr. Wesley Willis next, who's a psychotherapist, nurse, speaker, and entrepreneur. He's called the Nurse Doc, and he teaches people cognitive behavioral techniques to unlearn crippling behaviors and build new relationships. Learning to live a better life, he says, starts with you. And we want to teach you today how to not internalize negative messages. He has a doctorate of psychology, a master of social work, a behavioral science and nursing, a bachelor in social work, and he's also a CEO and thriving public speaker on relationships and lifestyle medicine. Dr. Willis, thank you very much for joining us. You can share your screen and I'll turn it over to you.
All right, thank you so much. Can you all hear me okay?
We can.
Okay. All right, I'm that student, just so everyone knows, I'm that student that, of course, why I have my own slides is because I'm that student who turns in things last. So, yeah, so I apologize to Dr. Collins, who asked me to be on this today. I have so many actual brothers on here that I know, faces that I see, fellow healthcare professionals who kind of out here in the struggle. We've heard from some amazing speakers, so I'm really, really excited to talk about self-care. Thank you, Mr. Young, for talking about advanced care planning. Also, Ronnie Dr. Urson, for talking about an area that's, I think, pretty significant, which is high blood pressure, as well as Dr. Ruffin for talking about primary care. The reality is a lot of people who come into mental health don't even always go to see their primary care physician. A lot of men that I see I would say that 75% of my 75% of my practice are men, and maybe 65% are men of color. So again, a lot of them have been drug in by partners who kind of like said, you need to go see somebody, or that, or it's just kind of gotten to the point. So I'm going to talk a lot about kind of like how we got to where we are. So if you look at this, like suicide is the 10th leading cause of death in the US overall. And this actual slide right here shows that suicide is the 7th leading cause of death for men. Number one being with like heart disease, because men are greatly affected by heart disease. Actually, women is number one in women, but higher in also in men. More so that number goes up. So basically, this is why self-care is so important, is because so many people, unfortunately, I mean, as you all probably know, most of you who are very well educated know that not a lot of people are open to mental health as a reality. So basically, we're going to go through and talk about this. So suicide and mental health, 78% of all people who die by suicide are male, according to the National Alliance on Mental Illness. In addition, leading research suggests that 1 in 5 people, which is roughly 21% of all adults in the US, are suffering from some form of mental illness, are diagnosed every year. So that is 21%. I'm a numbers guy. I need numbers. I don't know percentage. So that is a total of 52,900,000 people, basically, who are diagnosed in any year with an active mental illness that they need to get treatment for. Basically, again, depression, anxiety, all different types of things. So people who've been diagnosed, well, if 52 million people need it, then why are not 52 million people getting care? Again, limited resources and other things. So when do people get treatment? The average person is estimated to wait around 11 years while suffering from mental health problems before finally getting help, if they get help. And in some cases, due to the rising number of mental health cases, there's a shortage of qualified mental health providers. Those are your psychiatrists, psychologists, licensed clinical social workers, licensed mental health counselors, licensed professional counselors. The reality is we have expanded this so far, because really before, quite some time ago, we just had psychiatrists, psychologists, then licensed clinical social workers, then we had LPCs, and now we have licensed mental health clinicians to try to combat this overwhelming need that's kind of in the community. So why don't people get treatment? Many people think that just because they themselves haven't needed to check into a treatment facility or seek professional mental health, that they are exempt from needing to pay attention to their own mental health. Others think that while their mental health isn't great, it's not a top priority, because there's work, there's family, any other XYZ obligations in their life that take priority over bettering one's mental health. It's for each of these reasons that I'm here basically to talk about and explain why self-care should be considered a necessity, rather than kind of it's just something I would like to do. As well, while people would also benefit from implementing healthier self-care habits. So the case for self-care, basically, 46.2% of individuals that are diagnosed get care. So again, if we have 52,900,000 people every year who, again, have a qualified mental health illness, only 46.2% of those people are actually getting treatment. And of that 46.2%, 37.4% of that 100% of 46.2 are men. So again, men are even more or less likely to get treatment. So we established that mental health is a problem, sure, and it's a topic that is especially problematic for men, But what does that mean for everyone else who either doesn't feel that they suffer from mental health problems, or perhaps for those who don't allow themselves the opportunity to suffer? For example, some people feel they never have the time for anxiety attacks during the day, or they plan to let the depression hit them later, maybe in the evening when the kids are asleep and they can break out the Ben and Jerry's without having to share. I, for one, enjoy food. I enjoy food immensely. And if you look at my Instagram or my Facebook, I like to cook. And my aunt just said just 2 months ago, we like the fact that you cook online, but you see nothing that you cook is healthier in helping you lose that waistline. Because I eat at the end of a very long, stressful day of treating patients, and that's how I kind of like de-stress. So could self-care genuinely help people, and men in particularly, prevent or recover from mental health conditions? And what exactly is self-care? Self-care is something deliberate. It's natural to living things, but requires conscious effort to implement until it begins to become enmeshed with one's daily or weekly routines. It's not just something like, oh yeah, I'm hoping that it happens. It's a deliberate act that you put in your life. Self-care isn't necessarily universal, and what you find is that beneficial might cause stress or other negative reactions for someone else. In its essence, though, self-care is often defined as something that allows individuals and communities of people to partake in actions that lead to the betterment of health, prevent disease, and to cope with illnesses with or without the help of a healthcare provider. Self-care should not be conflated with self-indulgence, as more and more research points towards self-care activities being a necessity in order to maintain good mental health rather than a luxury. I don't know if some of y'all have friends like, some of us, what we'll do is basically, we'll be like, oh, I'm getting my nails done, self-care day. Okay, well, that's good, but it's not to be, again, for the individual. Sorry, something popped up on my screen. It shouldn't be conflated with this kind of like, again, this need to purchase things or buy things. Self-care actually should be seen as free. According to Lowell in 2020, positive mental health increases the capacity or ability a person has regarding self-care and can help people even with chronic health conditions such as hypertension, hypercholesterol, obesity, and diabetes. As you saw from that first screen, like as we see, I'll bring it back up, so you see from our, from the graph, again, we see heart disease leads the way for death of men, cancer, unintentional injuries. And when I looked at that kind of like unintentional injuries, as a therapist, I kind of say to myself, if people are living recklessly, if men are living recklessly, making reckless decisions that lead to unintentional injuries that lead to death, isn't that kind of basically similarly suicide? But I'll leave that out. I won't go there. And then for the other part of that, we have COPD, then we have diabetes, Alzheimer's, and then we have suicide, leading at 2.5 million men dying every year. So self-care basically can be done quickly, especially once the habits are ingrained, and doesn't need to be something that, is again, makes in any type of kind of like incorporate. Sorry. I thought I turned my ringer on. Oh no, it's some more. So self-care can be done quickly, especially once the habits are ingrained, and doesn't need to be something grandiose or expensive. Some men already incorporate habits and routines into their lives that count as self-care, such as trips to the barbershop or hitting the gym. There was recently a study that came out by a study and also an initiative by the National Association of Mental Illness called For All of Us, which basically they went to barbershops, salons, and places where men go and taught the providers how to implement self-care and mental health first aid in conversations with their men, because basically these are where men typically go. They don't typically come and see a person like me, especially right away. So by choosing to partake in activities that help improve physical health and hygiene regularly, one can build a lifestyle that feels natural, deliberate, and can help deter the deterioration of also our mental health. Realistic examples of self-care that have been proven to help individuals reduce their odds of experiencing burnout at work and manage stress from life and work include activities such as exercise, quiet time, and spending time with loved ones. As well, other activities that people find helpful, according to the University of Toledo study, that include eating healthy meals, talking, walks, drinking enough water, getting enough sleep at consistent times, drinking tea, sitting in sunlight, taking showers or baths, listening to music, reading a book, listening to a podcast, pray, meditating, or even simply taking a break. Because we see is a whole number of different things that we can do and that we can encourage our men and our women to do in order to help take care of themselves and their mental health. So despite knowing how self-care can positively impact a person's life, there's much stigma surrounding the topic of men seeking mental health care help, which has inadvertently also caused men to avoid seeking self-care habits if it's for the purpose of improving mental health. Through having more conversations about what it means to maintain positive mental health and taking action to improve each of our individual lives, we can destigmatize the process of seeking better mental health for every person in the community. Part of the stigma exists because people mistakenly believe as well that self-care activities aren't something for men or aren't something that they can benefit from. But that couldn't be furthest from the truth. It turns out that regardless of gender, marital status, age, and educational level, people who proactively attempt to engage in self-care management activities are able to experience improved mental health and are better able to partake in self-care activities, which in turn bolsters their levels of mental health. While self-care isn't a complete replacement for professional help, because I will tell you, like, no, you don't say that's the first thing to do is go take care of yourself. Hey, if sometimes people need to go see a mental health professional, but according to research, the benefit, it cannot be basically, you can't speak against the benefit. Through implementing self-care activities into your everyday life, you can improve your mental health, which in turn improves your ability to engage in further self-care activities. All people, regardless of gender, age, sex, can benefit from implementing these activities, but as discussed, the imperative for men to take action and include self-care activities into their lives may be all the more pressing. Overcoming the stigma of seeking help for mental health problems will take time, and in interim and long run, through utilizing these activities, can the daily life of men be improved today as well as down the line. Even the most mentally healthy and resounding individual can benefit from more deliberate self-care activities. And as discussed, it doesn't have to be something expensive in time or resources, nor complex or involving items and purchases one doesn't already own. So through simply choosing to do some things already part of our regular routine differently, deliberately, like choosing to work in front of a sunny window, for example, can self-care be readily and realistically implemented into our lives and can give us a very real and yet very unexpectedly beneficial result. As I've sat here and kind of like talked about this, you know, I love the fact that the brothers here basically have talked about, Michael Lewis talked about, you know, his running and his how that has improved his self-care, and probably even our own mental illness, our own mental health without realizing it. So so thank you so much, Dr. Collins, for allowing me to be a part of this conversation. I really appreciate it.
Thank you very much, Dr. Willis. I am going to put all of our speakers in the spotlight, and I do have a few questions for each of you. Give me 1 second to put everybody in the spotlight. And we'll start with Mr. Young, just because you started us off today. What happens to folks, or what happens in scenarios where there's nothing in place? Who ultimately makes that decision of what happens?
That's a very good question. So say, for example, someone is in the hospital and they have to make decisions about what to do next based on the status of that individual. Each state has, if you want to say a hierarchy, if you want to use that, where they may go to that person's spouse, or they may go to that person's parents, and then go down the line. And then it may get to a point where then someone, a representative from the state, may make that decision. So there are laws that are in place where that hierarchy will be followed if the patient doesn't have any, if the individual doesn't have anything in place. And then obviously if they don't have anyone identified to make those decisions, then that hierarchy will be followed in that order to be able to get to that end.
Thank you. Dr. Ruffin, 2 questions came in related to screening and whether those screenings are different in the African-American population. So colon cancer screening and prostate screening, do those ages change in the Black populations? And I think you may be frozen. I'm going to come back to you in just 1 second. Dr. Ursing, you mentioned fruits and vegetables. Can you talk about differences between fresh versus canned versus frozen? We know a lot of our population live in food deserts, and they may not have access to those fresh fruits and vegetables unless Mr. Lewis grows them for all of us. So can you talk about when there aren't options for fresh, what are the other options?
Yeah, I believe when there aren't options for fresh, because we know the fresh fruits are absolutely the best, because you do have to consider those canned fruits. It's loaded with sugar, glucose. So you want to be mindful, but we do understand that there are some people who don't have access to fresh vegetables and they resort to having to take on those fruits. And I believe you mentioned something about frozen, Dr. Collins?
Yeah, so you know, the option of frozen, is frozen better than canned when you don't have fresh, just to give folks options?
I would say the canned fruits, from what we know, all the information that we have, the canned fruits will be the last resort to maintaining a good diet around fruits. But and that's what I used to do all the time. Those canned peaches, love them. But everything I eat now is all fresh, straight out of the store, because I have access to that. But if it has to be frozen, then you do that. But definitely the sugar in the cans should be the last resort.
Okay, thank you. Mr. Lewis, thank you very much for your story. Somebody asked, how do you even get started? Like, I don't exercise now. I need to exercise. I'm definitely not going to go run a marathon. But how do I just get started to move to that direction?
Absolutely. So you just have to do it. The thing I will say is, like I did, find somebody to do it with you. It could be a friend, uncle, aunt, anybody who is interested or who will take out the time to do it with you. Find someone to do it with you because they provide you motivation and accountability. That was really how it started. And just start out with 30 minutes a day, like Dr. Ursing said, like that is ideal. And if you can't start out with 30, then you do 20. If you can't do 20, then you do 10. Some people, I hear a lot that I am nervous about how I'm going to look outside doing it. Then 30 minutes inside your house, right in your living room, push-ups, sit-ups, anything you can do. In the house, those canned peaches Dr. Ursing was just talking about, don't open them up and eat them because they are loaded with sugar, like he said, but utilize them as weight resources. So you can do things at your desk if you are still working from home. Take those peaches and do, arm raises, barbell curls, anything like that will get you started. Just start. That is the biggest thing. You have to do what's comfortable for you and just start. But the biggest way to do it is through support of someone else, if you have that. And can I just chime in on fruits and vegetables?
Mm-hmm.
Just So there is an ordering service that I use that I had to search. It's called Misfits Market, not to promote anybody in particular, but if you are in a desert, Misfits Market delivers fruits and vegetables at a lower cost. And that's actually how I started, because I hate going to the supermarket. So they bring it to me, much like Amazon. So just keep that in mind.
Thank you for that. Dr. Willis, the question is, most mental health care for males especially is given in the jail. How do we talk about increasing that access outside of the carceral system without the ability to pay?
All right, thank you, Dr. Collins. Yes, the education to prison pipeline is a significant problem for men of color. As we look at kind of like the disproportionate number of men who go from high school to prison versus Black men who go to the college classroom. And mental health is oftentimes plays a very big part in the process. And access, as it relates to cost, let's be honest, is problematic. I love the fact that kind of like, we've had this pandemic because it's greatly expanded how, providers reach patients, especially kind of like in areas where we have what we call the mental health, also kind of like desert, where you have like, there's some areas of Tennessee for one Black mental health professional, there are 500 patients waiting to be seen of color. What has to happen really is, again, SAMHSA, which is a very federally funded program, has instituted what we call the Minority Fellowship Project, where they help pay for individuals who are of color looking to advance their education in MSW, psych nurse practitioner, doctoral in psychology. And it was, luckily I got the opportunity to take advantage of it. So it's gonna just take, I think, literally just folks like us who basically kind of normalize it and basically increase the number of qualified mental health professionals by having conversations about the reality is that culturally congruent care is important. And that people who look like you, who are experiencing life the same way as you, benefit the most. So again, just bringing the conversation, SAMHSA, the National Institute of Health, basically has lots of money that goes untapped every year for, again, researchers who are interested in trying to increase the numbers of programs and insight and research for our community. That just, again, it's just going to take us really just kind of saying, you know what, I gotta take the time and really and do it for ourselves. We can't expect somebody else to do it for us.
Absolutely, thank you for that. Dr. Ruffin, do we have you back?
Yes, can you hear me?
I can. Did you hear the question?
Yes. So when it comes to the screening recommendations for colonoscopy, this is something that anyone would need to discuss with their primary care providers, because there are a lot of factors that take into consideration. Now, there is something with clinical guidelines. So we all, like in healthcare, use clinical practice guidelines, but our clinical judgment really work really well together with the guidelines. So the guideline, they give you a number that when things needs to be done. But again, so that's when we work with the patient based on your risk factor and to determine when things need to happen. Now, being Black alone is not a factor for early colon cancer screening, based on what I've read. But we take everything into consideration. your history, if you are a smoker, and if you are obese, if you have a diabetes or any other types of cancer in family history, all of these things contribute to help make the right determination as far as when you need to go for this test. It's the same for the prostate cancer screening.
Thank you. The last question, I'm just going to throw it out in the air, and anybody can take it. But the question came through: how do you handle older males that just don't want to change? There's a lot of behavioral psychology telling them they know what's best, but they just don't know how to adopt it and just make that change, or they don't want to change. Any thoughts about that perspective? Any one of you?
Dr. Willis, you want to handle that from a psych standpoint?
Wow. Well, so from a psych standpoint, what I found is, especially with our older gentlemen, these older men and older men of color, one thing that has really impacted and changed the way is, again, basically, you have to appeal to kind of like what we call in psychology, the generativity. So at that particular age, so later in life, older men, older women also go through what we call generativity, and they really kind of like want to get back. A lot of times because of ageism, because like even social media, older people feel forgotten. So they don't get the opportunity to connect with younger people where they feel like they're leaving a sense of legacy. So what shows to kind of greatly improve like their engagement is having younger people involved in their life, like having young people come to visit and things of that nature, because we all kind of want to leave a legacy. Nobody kind of, at that particular age wants to kind of like leave and wants to be forgotten about. But because, again, if I sit at home and I have no connection to the outside world, other than kind of like my television, I really don't have nothing as an older person to kind of not really live for, but there's nothing that kind of motivates me. I think that we have to really kind of go back to utilizing kind of our community. Even in as much as, people talk about, we recognize like there was a great amount of like, church hurt and all of that kind of stuff, which is real. It was a great sense of kind of like motivation for older people in our community. And if I think we get kind of like back to that, then we'll see older people kind of like really engaged and really much more proactive.
Thank you for that. Any other comments?
Dr.
Go ahead.
I was going to say, whoever comes up with the solution to change a Black male at the age of 70, gonna be a millionaire. Because I believe that is the most challenging thing, to change the mindset of someone who has done certain things for such a long period of time. When the question was asked, I immediately thought about my dad and my uncles. The one thing that I do is I try not to judge as a healthcare provider. I just give them the truth, the right information, and just tell them what is best based on all the evidence that I know, and let them decide, because it is very hard. And some of us on this call, we're 45 plus, we're gonna be there one day and nobody's gonna be able to change our minds. But not judging individuals, but just giving them the information to change their lifestyle or to do something different, I think is most helpful, and allow them to make the decision, because at the end of the day, that individual is going to decide what they want to do.
Thank you for that. Absolutely. I don't want anybody trying to change my mind when I'm a 70-year-old woman. All right, I think that's the last official question. Does anyone else have questions? I don't see any others in the chat or on my phone. I'm going to turn it over to the producer in the interim, just in case we get any more. But producer, I'll turn it over to you.
Good afternoon, everyone. I want to thank you all for coming. The hour is getting late. We've almost been on here 2 hours when normally we do 60 to 75 minutes. This has been an outstanding presentation. something that I think people on here need to really think about has been mentioned. How do we take this information that is shared on these webinars and make sure we're getting them to our grassroots community? And it was just today I was thinking, why don't we go to YouTube? Can we play some of these webinars in the doctor's offices or the waiting rooms? Can we post some of them on our Facebook pages? Because you're absolutely right. As I was looking at those numbers, I'm thinking I haven't practiced since 1992, and these numbers are the same, if not worse. But I want to thank my colleagues. This is our first all male nurse and friends presentation, and it was absolutely outstanding. Dr. Collins.
All right, thank you all very much. Thank you everybody who attended. To those of you who remained to the end, thank you. To all of our speakers, thank you all so much. We actually will be having a pop-up clinic, or really just a party for my birthday next Saturday at 11 a.m. So please plan to join us. You can see the link on the screen. But as I close out every webinar I have for the last 2.5 years, COVID is real. It is still with us. The numbers in some places are starting to rise. If you have not, please get vaccinated and boosted. Continue to wash your hands and distance. As we close out this program, thank you very much for spending a portion of your Saturday with us, and God bless and Godspeed.